I'm Dr Amel from City Skin Clinic, and welcome back to our channel. Today I want to talk to you about a topical treatment that I'm obsessed with, and it's tretinoin. Tretinoin is something that's becoming increasingly popular, and you might have seen a lot more about it in magazines, but it's basically from the family of retinoids. So these are derivatives of vitamin A, and the most famous members of that family are retinol and tretinoin. And I'm going to chat to you about what they are, why they're good for your skin, and how to decide which is best for you. So retinol, which most people are really much more aware of, is the kind of natural form of vitamin A. And this is a vitamin that we know topically. Vitamin A and its derivatives, when they're applied to the skin, they have been shown in clinical studies to reduce lines and wrinkles, to be beneficial with reducing inflammation and breakouts and acne. They have been shown to improve over time the texture of the skin, and to kind of help with hyperpigmentation and sun damage. And tretinoin is a synthetic derivative of vitamin A. It is stronger, and it's, as a result, prescription only. So you need to find an aesthetic doctor, a dermatologist that can prescribe it and dispense it for you. So why are vitamin A and its derivatives really important? Well, for the main thing that I mentioned, they're one of the few skincare ingredients that we know can help reduce the appearance of fine lines and wrinkles and prevent them from coming on. So from an anti-skin aging perspective, they're really, really useful. It's something that you can do at home. You can integrate easily into your skincare routine. And with regards to retinol, there are so many over-the-counter formulations that are available. From a tretinoin perspective, it works a little bit faster and it's a little bit deeper. And with tretinoin, it's great if you've actually already got lines and wrinkles and you're looking to reduce them and to prevent new ones. Both of these, but particularly tretinoin is licensed for use in acne. So if you suffer from acne, breakouts, if you've got texture and scarring, then tretinoin is great for helping with all of these. And in that situation, actually, it's better than retinol if you have ongoing acne that you've struggled with for some time. Sun damage, pigment, dark spots from being exposed to the sun, melasma, things like hyperpigmentation. So again, especially post-inflammatory hyperpigmentation, if you get acne scars, acne breakouts, and then once they've kind of broken out, you might get kind of dark areas where they were. Tretinoin is really good for helping fade with these. Retinol as well, but again, it just takes longer to work and it doesn't work as deeply. The mechanism of action for both of these is the same. They exfoliate the skin and they accelerate cell turnover so that you can shed the damaged skin, the skin that has aged, the skin that has sun damage, the skin that has acne scarring or texture faster. And the other thing that they do is they stop kind of pores being clogged up and epithelializing, so cells kind of abnormally depositing keratin and all of that into these pores. So this is really good, again, which is another reason why they work so well for clearing up acne. How do you use these? Well, because they exfoliate the skin and because they they accelerate cell turnover, they can potentially be irritating to the skin. And this is both retinol and tretinoin, but tretinoin is a lot more irritating to the skin. So what you can expect when you use either of these is redness that can happen, a feeling of dryness and flakiness that also can happen. Skin can feel tighter. And so if you are someone with really sensitive skin, probably retinol and starting on a weak concentration of retinol is going to be more appropriate for you than using tretinoin if you've got really sensitive skin, because tretinoin will irritate it a lot. If you're someone with kind of normal skin and you have very mild problems, so perhaps your skin is, or you're in your 20s and you're just looking for something to improve the skin quality, give it a little bit of a glow, maybe reduce sun damage that's already maybe happened, and as a preventative to prevent lines and wrinkles from forming, then retinol is much more suitable for you than tretinoin. If you're someone, however, who's already got sun damage, or you've got acne that's active and that's ongoing, you've got texture or scarring, you've got melasma or hyperpigmentation, you've already got lines and wrinkles that you want to treat and prevent more from coming, then tretinoin is quite great in that situation. Again, it's important to kind of get advice, particularly with tretinoin, see someone who has experience with prescribing and helping people integrate tretinoin into their skincare routine. And this is why, if you're in the UK, we offer a virtual skin clinic, and our doctors can work with you on tretinoin and also integrating things like that into your skincare routine so that you can get the most out of the tretinoin and your other skincare products. So with tretinoin, it's great in those situations, in my opinion, and you can really get a lot out of it. Just be prepared for some downtime. So you don't want to start tretinoin if you've got an important event coming up. You want to start it a few months before a wedding or a major photo shoot or a celebration, just because the first few weeks there is some downtime to get used to. That can involve skin, like I said, flaking, looking dry, looking a bit irritated. Also, sometimes with both retinol and tretinoin, if your skin finds it irritating, you might have to reduce the frequency that you use it. So often with tretinoin, when we start people on it, we start them, if they don't have any problems with sensitivity, we'll still start them on something like 0.05% and maybe start it every other night or every 3 nights until their skin gets used to it, and then you work up to once a night if they get to that point. Some people get to that point sooner than others. Some people just need every other night. And then the same goes with retinol. If you are starting on retinol, start it every other night initially, and don't kind of go too far too soon. So once your skin is comfortable with it, you can step it up. Both of these, just like other exfoliants, just like things like exfoliating acids, they make your skin even more sensitive to the sun. So you absolutely should be wearing SPF anyway, but particularly if you're going to use retinol or tretinoin. You should be wearing SPF. You should use retinol and tretinoin at night only rather than during the day. And be prepared that even if you have oily skin, your skin might feel drier and it needs more hydration. So having a really good moisturizer, especially at night when you've applied them on and in the morning. It can sometimes be a little disheartening if you start something and your skin starts to react not so well to it, especially if it's something that's supposed to improve your skin. But actually a bit of perseverance. Remember, with both retinol and tretinoin, retinol in all the studies, it takes about 8 to 12 weeks for people to start seeing an effect. So patience is important. Tretinoin is the same. You need usually about 4 to 6 weeks to start seeing an effect. So there's no rush. Don't stress out your skin because this is a kind of medium to long-term treatment. The effects are great. They are long-lasting, but you need some time. For people who start tretinoin, so my patients often ask me before they start, is this something that they have to be on forever? Well, I say no. Actually, if we're starting tretinoin for a specific problem, whether it's melasma, whether it's hyperpigmentation, whether it's acne, any of those things, then no, we can get to a point where you're happy with your skin on tretinoin and then step down to retinol. So it's quite fluid. On the other hand, for some people, actually being on tretinoin, the skin really likes it, and they can be on it for a really long time, for however long they need. It's a really well-studied ingredient. It's been around for a long time, as long as it's prescribed to the right people. So who shouldn't have retinol or tretinoin? Well, if you are pregnant or planning a pregnancy, it's a big no-no. If you are breastfeeding, I would say to stay away from both of these. These are the big no-nos. Others are, if you're someone with extremely sensitive skin, I would definitely say no to tretinoin. And even if you start retinol, use the smallest concentration, the lowest concentration you can find, and even then do it once every 3 days. And if your skin doesn't like it, you just might have to accept that's a no-no. Again, if you have rosacea, being really careful with anything that can potentially irritate the skin. So I would not, I would say, you know, those are the big things. And obviously if you have an allergic reaction to either of those products, then I would say to stay well away from them. The majority of people tolerate tretinoin and definitely retinol really well, but as long as you're kind of not in those groups where I've just said, stay clear of them. Anyway, I love tretinoin. I'm a regular user of it. I think it's great, and I think everyone who can be should at least be using retinol, because it's one of the few anti-aging ingredients that you can actually just find over the counter, and with some patients it does work, and it's a great preventative, and it can also help with skin aging that's already kind of set in. If you want any more information about retinol or tretinoin, I'm going to leave some links on our website below. If you have any questions, just leave us a comment, and don't forget to like and subscribe to our page, and ring the notification bell so that you know when our next video is coming up. Until then, have a great day.